Okay, so you're going to go the rest of the way in, same as usual.
So it's working. We might just have to repeat it twice. Because it's loudly.
When we've had patients who've had their surgery and then their chemoradiotherapy, so radiotherapy with chemotherapy, they finish that treatment and then for 6 months they're maintained on some further chemotherapy. And when we scan the patients halfway through that chemotherapy and at the end, we sometimes have appearances which look like the tumour is growing back. And in some people, it's not actually tumour growing back, it's actually what's called pseudo progression. So it's a reaction to the treatment that they've had that looks like a tumour. This creates a lot of issues, both from the patient's perspective, because they don't have any certainty. They're worried, has the tumour come back or has it not come back? Also for the clinicians, the doctors that are treating them, because of this uncertainty, they don't know whether they should continue on the current chemotherapy or change to some different chemotherapy. And all in all, this really has a big impact on treatment, particularly from the patient's perspective in terms of quality of life and anxiety, and from the doctor's perspective in terms of how they treat the patients.
So this is a very typical location that we would receive tissue from in an epilepsy patient.
You can only go to scales that are about 10 fraction of a millimeter, so something like 10 micrometers. When you look at this information with field cycling, you can see motions that are much smaller than that. So you can go below the scale of a cell.
I find that to be really difficult to look at, but we can get you some images of that as well. Yeah, so that the writing of.
So when the tumor cells are multiplying, they generate this kind of what's called metabolic water, which is excreted by these copper internals. And this motion of water through the membrane is detected by this field cycling technology. So by using different fields and getting images in different fields, you can actually detect if the tumor is active or not.
Yeah, say whatever's white. Yeah, whatever gives look like that's the best. That looks good to me.
Not only we can detect cancer from healthy tissues, but we can see if the cancer is being aggressive or not. There's different type of signal depending if the tumor is just growing or if it is spreading, which are the two types of behaviors that you can see in cancer. So this is very encouraging. Of course, we need a lot more work to see if this holds true and if it's a robust finding. But it's certainly very encouraging results that we have so far.
This is a disease, glioblastoma, which is a disease where we have very limited treatments at the moment that are available. So there's a real need for clinical trials. And one of the issues is if you don't really know how patients are responding to a trial treatment, it's difficult to know how effective they are, and it's difficult to develop new treatments for this disease. So if we have field cycling imaging, and in our studies and subsequent studies show that it's going to be beneficial in glioblastoma, this could open the way to huge opportunities for future treatments in this disease.